Hi, Larry Taylor here with the Word in Focus. Another myth that I hear about the COVID-19 pandemic is that doctors and hospitals, it is said, are paid more if they diagnose COVID-19 as opposed to something else, and therefore the numbers of diagnosed COVID-19 patients is exaggerated, and therefore the number of COVID-19 deaths is exaggerated. Once again, especially as believers, as followers of Jesus, Jesus who is the way, the truth, and the life, all of us need to make certain that we are receivers of the truth, and that the things that we are sharing, whether verbally or social media or however, are truthful things. There are many areas where there are shades of truth and nuances and all of that. This is not one of them. Hospitals and doctors are not paid more if they diagnose someone with COVID-19. There is no conspiracy among healthcare professionals to overdiagnose COVID-19 or to misdiagnose COVID-19. To do so would be insurance fraud. If Medicare is involved, to do so would be Medicare fraud. Insurance fraud, Medicare fraud are felonies. A doctor or a nurse or a other healthcare professional, respiratory therapist, so on, would lose their license if they did that. I've worked in hospitals for years. I'm around doctors and nurses on a very regular basis. I know lots of them. I have never met a physician or a nurse that would even come close to doing such a thing. They would not even consider it. They wouldn't even think about it. In their minds, it would be an unthinkable thing to do. It simply doesn't happen. Now, there are some additional resources available to fight the pandemic, coming from some sources like Medicare, because fighting the pandemic requires additional resources. It requires a lot more personal protective equipment. It requires high-tech hospital rooms, intensive care units, ventilators, supportive medicines. It's expensive to treat anyone in an ICU. It's expensive to treat anyone who requires a ventilator in order to live. So there are some additional resources. But the idea that there's this nationwide conspiracy to overdiagnose is complete nonsense. And the idea that physicians would mark down COVID as cause of death in order to get more money. There is no money once a person dies. That is absurd. It's just absolutely absurd, and it's disparaging. It's slander against those hard-working, dedicated doctors and nurses that are out there fighting this battle on the front lines. So please, my fellow sisters and brothers, don't pass along false information, especially false information that implicates good-hearted people who are sacrificing in order to bring health and wholeness to all of us.